Hi, I'm Becky DPT. Today, let's talk osteoporosis. Osteoporosis is a condition when our bones become weaker and they lose the minerals, so they become porous. So they're not as solid and strong as they once were, and then we're more likely to have a fracture. Once we hit 40 years old, our bone doesn't regenerate and rebuild as quickly as it once did before. It then makes us more prone to have a fracture. The changes in hormones make a big difference. So as we age, our estrogen, testosterone starts to decrease, and that makes us more prone to bone changes and a more weakened bone. Anticonvulsants are a medication, and so is prednisone or steroids that can also weaken our bone. A couple medical conditions that can increase or speed up the risk of osteoporosis is hypothyroidism and rheumatoid arthritis. So a couple tests your doctor can order to determine if you have any bone density issues are a blood test to determine what levels your vitamins and your minerals are at. And they can also order a bone density scan, a DEXA scan, to see if you have any bone loss. There aren't really too many symptoms. A lot of times we find out that we have an issue with our bone density just because we have maybe had a fall, we've had a weird fracture. We go to the doctor to be seen, to have our fracture treated, but then we find out that we have bone loss. A couple of things that you might see are rounded head and shoulders. So instead of having a good upright posture, you're a little bit more rounded over, and it's hard for you to straighten up. Sometimes you have back pain that just kind of starts out of nowhere. Another thing that can happen is you decrease in height, so you lose an inch or two. Your doctor does have some medications that they can order to help you maintain your bone density. But a couple things you can take over the counter are calcium supplements, and you can also take vitamin D. If you take vitamin D, you also have to have K2 with it for that absorption into your body. Another great way to help combat osteoporosis or osteopenia, which is the start of that bone loss, is weight training. Any weight training exercises, lifting weights, and it has to be a moderate amount. You can't just lift a couple pounds. You need to lift something that it's a little taxing for you. This helps to maintain your muscle mass, but also that bone mass within. One of the best things, even beyond that weight training, is weight bearing. So if you were doing squats, you can be holding weights and doing a squat. You can have it overhead. Any plank activity, so down onto those elbows is very good. Or push-ups or tricep dips. Where there's a will, there is a way. You can do a tricep dip on your kitchen counter, just a little elbow bend. That puts that weight bearing through those arms. You can do a push-up on the wall, where you put your arms up on the wall, you lean out from it, and you do your push-up this way. That still provides good weight bearing through your joints, through those arms to strengthen that muscle and bone. Hopefully, this gives you some ideas on how you can combat osteoporosis. Have a good day.